Chlamydia is a sexually transmitted disease, caused by the bacteria Chlamydia trachomatis. It is spread or acquired through an unprotected vaginal, anal or oral sex with an infected partner. It can be spread even when ejaculation does not occur. Pregnant women can also transmit it to their babies, especially during delivery. Chlamydia can affect both men and women, however, it is most common among younger women. It can affect several organs in the body including the penis, vagina, cervix, urethra, rectum, anus, eyes, and the throat. It can be treated and cured with antibiotics such as doxycycline and azithromycin. Welcome to Disease SNS. In this video, we will be talking about 10 signs and symptoms of chlamydial infection in women. Please subscribe to our channel for more videos like this. Number 1. An abnormal discharge from the vagina. When you acquire chlamydia, you may notice an unusual discharge of a milky or watery substance from the vagina, which is often yellowish in color, but it can also be whitish or grayish. This discharge usually appears within 1 to 3 weeks of exposure, and occurs as a result of the negative effect caused to the vaginal microflora or rectum by the bacteria. 2. Painful urination. When you acquire chlamydia, it can cause the inflammation of the urinary tract, such as the kidney, ureter, and urethra, causing a burning or stinging sensation when urinating. You may also notice a thick substance called pus in your urine, which may be whitish or yellowish. 3. Frequent urination. When you acquire chlamydia, you will experience an unusual urge to urinate, and this can happen even if you are not drinking too much fluid than usual. You may feel this need a little while after urinating, and when it happens, only a little urine comes out each time. 4. Painful sexual intercourse. Chlamydia can cause the irritation of the vagina, which can cause a burning sensation during a penetrative sex. 5. Bleeding after sex and between periods. Chlamydial infection can make the cells of the cervix to become more fragile, causing an unusual bleeding during or after a penetrative sex, and also between periods. 6. Itching in and around the vagina. The bacteria that causes chlamydia can cause the inflammation of the urethra, leading to an unusual discomfort or itching around the vagina. If you notice an unusual or a persistent itching around your vagina, it could be as a result of chlamydia, especially when it is associated with other symptoms. 7. Pains in the back or abdomen. The bacteria that causes chlamydia can travel up from the cervix and uterus into the fallopian tubes and ovaries. When this happens, you may experience pains in the back and in the lower abdomen. These pains usually occur as a result of the inflammation of the various areas by the bacteria, and the pain may be cramping, dull, or even sharp. 8. Throat and eye symptoms. You can also develop chlamydial symptoms in your throat when you have an unprotected oral sex with an infected partner. This may cause pain and sores to appear in your throat, and around the lips or mouth. You can also develop these symptoms in your eyes, especially when your eyes come into contact with the chlamydial discharge from your vagina or from your partner's genitals. This usually happens when you touch the discharge with your hand, and immediately touch your eyes with it without proper washing. This can lead to the discharge of a whitish substance from the eyes, redness of the eyes, persistent tearing of the eyes, and swelling of the eyelid. 9. Fever. When chlamydia spread to other parts of the body, it can cause fever and chills. It may also arise as a result of the body's fight against the bacteria. Fever is an increase in the body's temperature, which may be as a result of the body's fight against pathogens, or exercises and other conditions. 10. Nausea. Nausea is a discomfort in the stomach, and the sensation of wanting to vomit. This symptom usually appears together with fever, and occur when the infection or bacteria has traveled up to the stomach. The signs and symptoms of chlamydia are very similar to the symptoms of gonorrhea, and in most cases, they do not appear. It is advisable to always go for a regular screening on chlamydia and other sexually transmitted infections, This is because, when the infection is left untreated for a long time, it can lead to serious health problems including pelvic inflammatory disease and infertility.